Hello all, my name is Peter Murphy-Lewis. I'm the host of LTC Heroes. I'm really excited to be here streaming at Georgia Healthcare Association. Today I'm joined with Donna Stefano. I got that right, right? Yep. And she is the administrator at Southern Pines from Warner Robins, Georgia. But you're also the past chair of this association. I'm really honored to be here. I'm excited to talk about why this organization is important to you. Tell me, just to get started, who's a friend, a coworker, a colleague, a mentor that you are most excited to see in person after these rough 2 years here at the convention?
Oh wow, that's a loaded question for sure because there's just so many folks. I mean, this our industry and this organization, Georgia Healthcare, is comprised of some really great people who are committed to what we do every day for a living. And there are just the list is endless of people from vendors that we deal with that know they understand where we're coming from, to peers who do the same thing I do for a living, to owners of companies, big and small. So I can't name just one.
No worries, no worries. I wasn't gonna put you on the spot if you couldn't think of one, because you probably hugged 100 people last night at dueling pianos. One of the things that I really love to do after getting the long-term care, I realized everybody has an amazing story. And I tend to call it the long-term care initiation. And it's usually someone really important who got you in here. It might be a quote, it might be a random job. Can you take me back to what your first initiation was and why it's important and how you still remember it?
Absolutely. So I've actually been a licensed administrator for 29 years, but I've worked in long-term care for about 37. Um, and that being because back when I first started as a receptionist and a bookkeeper, um, you had to do like an 8-year internship to even try and sit for your boards if you didn't have a college degree, and I didn't. So, but back to the very, very beginning, I answered an ad in the newspaper for a bookkeeper / secretary, right?
Mm-hmm.
So I go, and it's a nursing home. I walk in, and it was very nice. It was very pretty inside, and there were some happy-looking folks sitting in the lobby, and I thought, well, I don't know. We'll see. So I interviewed for the job. They called me back a day or two later and said that I had gotten the job. Okay, good. Well, we'll see how this goes, because I was a little apprehensive about working with elderly. I had not done that. I didn't know, right?
Right.
So I go, and needless to say, one day leads to the next, and to the next week, and to the next month. And I developed a passion for the people that we serve. And it became abundantly clear to me that I needed them as much as they needed me. And that's where it started. I still remember those residents. I still remember their names. And that's been 30 plus years ago, you know?
I love the quote that you said, Donna. I needed them as much as they needed me.
Absolutely.
I love that. I've never heard it that way, and I'm going to write it down.
Okay.
I think that's brilliant. Donna, the question related to is, you might not have known your first 6 months. You might not have known even at the first 2 years that you were going to be here for 30 plus years. Do you remember maybe when you went home or you told a best friend or a girlfriend, you said, I really like this. I might be here in 10 years, maybe 20 years. Do you remember then?
I did. I know my mom had to loan me the $200 or whatever it was to take the boards, and I had to pay her back, of course, and I said, I really, now that I'm an administrator, I'm convinced that this is what I'm going to do for the rest of my life in some form or fashion. And I've been a VP of Ops and traveled and did that kind of stuff, but I'm back in a nursing home with the people that I love.
My follow-up question, I didn't have a prompt for this, but your answer made me think of it. What's the best decision you've made professionally? Is it that? To take your exam?
Absolutely.
What about personally? Best decision?
I have 2 wonderful children.
I did some recon work on you before we started recording. They said, oh, she loves her kids. You talk about her kids, we could be there for a while.
Yeah, actually, my son is here. My husband works in an industry that deals with a lot of us, and my son works for my husband. Oh. So he's here, and my daughter is an RN.
It's nice to be able to travel with your family then.
Yeah, it's great.
Donna, I want to transition into your leadership. You were chair of Georgia Healthcare Association. What month did you come in?
June of 2019.
And so you were right in the middle of the pandemic.
Yes.
Can you take me back? And I want to hear the emotions. I want to hear what went through your mind when you called your best friend or you called your coworkers back in February or maybe even January or as late as March when you realized this was getting out of control and you were in charge, the leadership of the most important association in Georgia.
It was a very trying time, to say the least, and a burden that I carried because that was my responsibility, was to make sure that the membership of this association continued to be served and that those folks in our building continued to get what they needed, be it the services or the equipment, PPE. This was all before a vaccine. We were all worried about how we were going to have enough face masks to be able to function. And it was trying. We met diligently on the political front to try and get assistance, financial assistance from the state. My boss, Debbie Mead, worked on the national level at GHCA doing the same thing. So I will tell you this, though. We were at summer convention. I don't think it was this, maybe it was this last one. And I never realized how hard it had been on so many people involved in this industry. We ran a list of names of people in our business, co-workers, that we had lost through the pandemic. And it went on and on and on. And I was standing on stage watching, and tears were just running down my face. And I'm sorry if my voice is getting a little cracky
yeah, me too. We're both going to be crying.
I looked out into the audience. It's kind of hard to see with all the lights and stuff, but everybody had a tissue, and I thought, these are people that were vital to our profession. They served just like I do, and they're gone now. And it was probably at that point I realized really, really how heavy that had weighed the whole time. And the political thing was obviously stuff we had to do. We had to fight to procure PPE. When vaccines came along, we had to establish ourselves to get in line to get that done. But the actual loss of life, I think, is probably what I would carry with me forever.
Different leaders react in different ways. How did you react in March when you had to be the spokesperson? Did you quit sleeping? Did you meditate? Did you decide to pick up Peloton bike? Did your husband say you're sleeping in another bedroom because you're stressed?
Actually, the only way I know to fight something is to know everything I can about it. So I had to learn everything I could learn about COVID. I had to learn the nuances of the virus. I had to understand how it transmitted, to the point that I carried around a book and I recorded the numbers daily of the county I live in and the county I work in, so that I could monitor for myself how this virus was affecting us. I read everything I could read about it, not on the internet and not listening to the news. I did research. And at one point, my husband did tell me, put the book down. That's enough. You've been doing this for 6 months straight, and you can't keep doing it. But I had to know, we couldn't fight what we couldn't see. So we had to know about it. And there were a lot of things we had to change, and those changes affected our lives that work in this business. Everybody you meet will tell you something different about how it affected them. I think for me, I was fearful in the beginning, but once I began to understand what we were fighting and that we could gain knowledge over it, if nothing else, that was going to help us in the long run be able to fight this virus. So then it became like a challenge, and I don't like to lose at anything. So we were going to win. So how are we best going to do that? And that's kind of how our mindset has been with our residents in our facility.
Donna, everyone knows that during the pandemic, all the mistakes that we made in long-term care was put on the front page of every newspaper.
Yes.
what's something that didn't get on the front page that you're really proud of that you did?
Everybody wants to talk about all the negative things that came out of that. How many patients in a nursing home had COVID? How many patients died of COVID? Well, I can tell you that I run a very small facility. We're max of 66 beds. At the time COVID came in March of 20, when I went there, we were starting to pick up, but we kept saying, we don't have COVID, we don't have COVID. Well, how do we know we don't have COVID? We're not testing. We got to test in order to know. We did. And when we tested, we found that about 22% of our census was COVID positive. At that point, now we know what we know. Now we know how to deal with it. From there, we know how to do isolation. We know how to use our PPE correctly. We know we need to stop visitation and communal activities. We know all those things. That was the easy part. So now what we had to do is nurse those people through COVID. Fortunately, in my facility, very few of them were sick. No one ended up in the hospital, and we didn't lose anything.
That's something to be proud of.
Correct. We did not, after May of 20, the next time we had a COVID resident positive was a year later, just about, and just one. And she recovered. She was asymptomatic.
Yeah. So it sounds like truly in your organization, your facility, you guys are coming out of COVID strongly and positively. What's your challenge in 2022 now that we got the worst side behind us? Are you thinking of staffing? You got census. What's your number one challenge in the next 3 months?
My number one challenge for me is staffing, and that's because I got to have the staff to be able to raise census numbers, because I got to be able to take care of the people. If I can't take care of them, they don't need to come in.
Yeah.
So we gotta get staff, and we've got to get qualified staff. We can hire and train CNAs all day long, but you can't teach what it takes to be a CNA. They got to feel it.
Ooh.
You can't. I can send you to nursing school and make you an RN, but if you don't have that genuine sense of compassion and just how to treat a fellow human, you're not going to be a good nurse. You need to be working in a lab. Well, those aren't the nurses I need.
Man, you're just dropping some really value bombs, some great quotes. You said you can't teach what it takes to be a CNA. I got my CNA certification in December in the state of Kansas, so not too long ago. And my first day of clinicals, the CNA that I was training underneath, he says, "Peter, this is a really easy job if you care about people." And he goes, "All the things they've taught you before, that's fine. If you came here with a heart, that's what matters."
And that's true.
Oh, man.
That's so true. Because you can't teach that. You just got to have it.
Donna, I want to just take a moment, and I want to thank the Georgia Healthcare Association's Winter Convention for inviting LTC Heroes, and thank Experience Care for sponsoring today's live with Donna. Now I just want to transition into some rapid fire questions. And I warned you beforehand, if they throw you off, just say pass. That's a bad question. I can deal with it. My wife says meaner things to me than you telling me to pass. So let's get started with, let's go here. In the last 5 years, Donna, what new belief, behavior, or habit has most improved your professional life?
Oh my gosh. Trying to learn to manage stress. I like to read. I enjoy a good novel, as we were discussing earlier. So I do enjoy reading. I love to travel. We have a travel trailer, so we travel. We have friends that have them.
Oh, that's
we
awesome.
Travel with friends. We go camping. I'm a NASCAR enthusiast. So I'm all about some racing. So we live about 11 minutes from the Atlanta Motor Speedway, but we go over there and stay for 4 days. So I've had the opportunity to go to Daytona. And so things like that help me to be able to do those things in life, help me de-stress for the normal grind.
Thank you for sharing that for a weird question as well. I'm going to do this one. If you could have a gigantic billboard anywhere with anything on it, metaphorically speaking, getting a message out to millions or billions of people, what would that billboard say and why?
I would thank all the healthcare workers across the country.
Oh,
Because without them, we'd be in a hot mess.
Yeah.
And I think that's the message that constantly needs to be sent. Thanking those folks that work in all forms of healthcare. And I don't mean a nurse. I mean, there has to be a housekeeper, and there has to be a laundry person, and there has to be dietary we have to eat. And we've got these activities assistants and professionals who have done such a great job trying to keep our residents safe and motivated and happy and healthy during the pandemic. The social workers for all they do, the maintenance guys, the list is endless.
I love it. Big billboard. Thank you. Let them know that it's
absolutely
the healthcare workers.
Yep.
And I forgot to mention, going back to the previous question, Donna and I were speaking about, we're both big connoisseur of spy books. So even if you're not in long-term care and you're watching this recording, send Donna an email for her list of spy books.
Absolutely.
Next question, Donna, is in what ways have you grown over the course of your life?
I'm a stronger person now than I was when I was younger. I think I've learned some very essential qualities about dealing with people. I am also a cancer survivor, so I have a very different outlook on life now. I take more of that seize the moment kind of thing, and also appreciate everybody that I'm around and that I know and that I love, because there's no guarantee on any of that time that you're here, and I know firsthand that. So, I think that's probably
that's a great answer. Deep. This next one I don't think would be quite as deep, so just preparing you for it. What celebrity would you be best friends forever with?
Oh my gosh. What celebrity would I be best friends with? You know who I'd like to think that I would be best friends with? Dolly Parton. She's the kind of person that
she has a good sense of humor.
Appears to be awesome qualities as a human being. She's talented, she's funny. I think I would like to sit down and talk with her, and I think we'd be friends.
Have you been to Dollywood?
No, I haven't.
I haven't either. We should go with our spy novels. Donna, this is one of the last questions that I'll ask you. What's the most childish thing you still love to do?
The most childish thing I still love to do. I don't know. Gosh. I don't know. I still do a lot of things I think people my age shouldn't do.
Well, Donna, thank you so much for joining us. I know some of the audience who's watching this now or recorded is going to want to reach out to you. You've said some amazing quotes. Where can we find you online? Your website, your LinkedIn? What's the best place to connect?
I don't have a LinkedIn and I don't have a website, so I have an email.
You want to share your email with us?
I will. It's Stefano, Stefano @me.com.
Wonderful, and I'll put those in the show notes. Donna, thank you so much for joining LTC Heroes. It's a pleasure to be here. I wouldn't be here if it weren't for your leadership in the Georgia Healthcare Association, and I'll see you around the room. Plus, I know we're both hungry, so we're going to go get some food.
Absolutely.
See you all. Thank you.
This has been fun.
Bye-bye.